Welcome back to 10 Minute Takes. My name is Hannah Gallacher and I'm here today with Lee Ranyard-Lant, who is the Senior Clinical Lecturer for the Non-Medical Prescribing Programme. Is that right?
Yep.
Do you want to tell me a little bit about your role before we start?
So I lead the Non-Medical Prescribing Programme. It's two separate modules. There's an enhanced prescribing for healthcare professionals, which is at level 7, 40 level 7 university credits.
Brilliant.
And the other module is prescribing for healthcare professionals, which is a level 6 module, again 40 credits.
What's the difference between the two levels?
So it's to do with the academic level and where the student is on their academic career. So for those who don't have a full degree, they can use the credits from the prescribing programme to go towards a full BSc. And for those who have a BSc, it's evidence that they're studying at master's level and can go towards a full master's programme.
Brilliant. Okay, thank you. So I always ask people to start with to share a lesson that they've learned as an educator that they wish they'd known a little bit earlier.
Good question. I think my answer is to believe in themselves and not be daunted by education. Certainly not here at the academy. You know, we are student focused, we support students and we want them to get the best from the education. We do select students and have an entrance criteria so that we know that they have got the ability and we'll support them to achieve.
We're invested in our own staff, aren't we? We want them to do well.
Yeah.
So supervision is a really important part of the non-medical prescribing programme. How do you make sure that's consistent and how is that worked into the model of delivery?
So it's a broad spectrum that the programme covers, and it covers anybody who works as a nurse in a specialist or a practitioner role, and that can be anywhere within the trust. So the supervision and practice is definitely key to them being successful in the programme. Because it's such a broad area, we couldn't teach everything in the classroom. It does have to be the learning that they have here in the academy, they then take into practice and apply that in practice, and they need an assessor and a supervisor to observe that practice, to have those discussions, to help them fully explore and expand their knowledge base to be safe and effective prescribers in practice.
What's the difference between an assessor and a supervisor?
So it's like any education in nursing, it's the NMC standards that say students need to have an assessor, they also need to have a supervisor, and that just gives some objectivity to the assessment and practice, so it's not just one person who's having to make that decision. So the students on the prescribing programme, they have a named assessor, they also have a named supervisor, but they can have multiple supervisors in the programme in different areas of practice to give them that broad experience. They then feed back to the assessor about the progress of the student, if there's been any areas of concern that might maybe need some additional focus to help development. So we can be assured that the students have been thoroughly assessed and the sign-off of that proficiency is agreed by multiple professionals, not just one person.
Brilliant. So the assessor kind of brings it all together.
Yeah.
Okay, that's great. So how do you make sure that at the heart of the delivery of the non-medical prescribing programme that you're keeping patient care and patient-centred care as the focus?
So the academic part of the programme is academic, but it's also related to practice and it's related to Northumbria. You know, we refer to the policies in the organisation, the areas that people be working, the people delivering the programme work in Northumbria, so we're all about our patients and we can focus the programme on the patients' needs here at Northumbria. We also have sessions with patients coming in to talk about their experiences, what's been good, what's been not so good, and their experience of dealing with prescribing and having, you know, their needs assessed and having medications prescribed, and they're there as a resource to talk to the students so students can learn from their lived experiences and bring that to their practice.
So obviously the non-medical prescribing programme is quite an undertaking. What advice would you give to someone who was thinking about doing this level of study that maybe needed to explore that in more detail?
There's lots of support in the organisation, and it is a regulated programme, so we have to be careful and not just say it's open to everybody, because
Yeah.
it does need to be a part of that person's role. So in the first instance, maybe talk to the line manager, the supervisor in the role, to make sure that there is a fit. And then we have non-medical prescribing leads in the trust who kind of oversee the governance and the access to the non-medical prescribing programmes, who the potential students can talk to. And ultimately, if they want to get in touch with me at the academy, I'm happy for that as well, and happy to have a chat with people to help guide the decision.
Because it's quite a big undertaking, is it, being a
It is,
prescriber?
yeah, it's a big programme. You know, most modules are 20 units. This is a 40 credit module, so it's a big undertaking and there's a lot of work involved. But it is, you know, it's a big responsibility to undertake the prescribing role in practice. So therefore, it does have to be stringent in the preparing of the students.
Yeah. And how do we support people who are also working full-time? How does that work with a full-time job to do this?
So that's what has to be agreed when they're going through the application process, and have that discussion with the line manager and also with the non-medical prescribing leads, because they have a day where they have to be available to come into university.
Okay.
But then they also need time away to do some learning in practice, and they have to undertake 78 hours of observed sort of practice and prescribing.
78. That's very specific.
10 days.
Right.
So
Okay.
that's 75 actually.
75. Brilliant. Yeah, so it's like 10 full days observed practice.
Yeah, but that can be split into different chunks.
Of course. Yeah, that would be a long 10 days.
Yeah, and you know, a full day, you're not going to be prescribing all day, every day.
Yeah.
So it can be split into specific clinics or, you know, ward rounds and different activities.
So, thinking about your career as an educator, what is your favourite thing to teach?
This is going to sound really corny and really, but communication skills.
Okay.
I think good communication is at the heart of everything that we do as a nurse, regardless of what level of practice. And getting that communication right means that you are listening to the patient, you're putting the patient at the centre and making the patient feel listened to.
Yeah. Right. Unexpected, but thank you.
You're welcome.
Thank you for coming today.
Anytime.
Brilliant.